It's almost 50 years since community health centers began to fill a service gap in healthcare. More recently, the gap has also been filled by other kinds of providers, such as urgent care and walk-in clinics. Studies have shown these new providers can treat many patients effectively while saving money that would have otherwise gone to hospital emergency rooms. But the providers are also a challenge to the care model developed by health centers. To bring us up to date are the Executive Director of the Mass Health Council, Susan Servais, and an Associate Professor of Healthcare Policy at Harvard Medical School, Dr. Ateev Mehrotra. Thank you both very much for being with us.
Thanks for having us.
You've been following these new kinds of providers. I guess one thing about Massachusetts is that we're coming to this kind of late, but how's it working here?
Yeah, so as you said, Chris, most of these retail clinics emerged on the market about 7-8 years ago, but the clinics that have opened here in Massachusetts have come more recently. But what we hear from the retail clinic providers is they're very popular, and I think that it comes from Massachusetts healthcare reform and really a need for more people getting primary care, and as people get primary care, that leads them to more demand on our primary care providers, and therefore the wait times that people are experiencing to get into their primary care provider is increasing, so therefore they're looking for other alternatives, and these retail clinics and urgent care centers are meeting that need.
So what kind of things they take care of? I know at one end of the spectrum you have the most routine things like flu shots, but what about the other end?
Yeah, so most of the visits that we've seen have been for immunizations, primarily flu shots, but then for simple acute problems. So things such as you're worried you have sinusitis, you're worried you have strep throat, your child might have an ear infection, or you're worried you have a urinary tract infection. Those occupy the vast majority of the visits. The clinics themselves, these are retail clinics. The urgent care centers can also provide things. You're worried you have a broken bone, you need stitches for a small cut, you sprained your ankle, those kind of things where you might need some x-rays, etc. They are expanding into other areas of care. The retail clinics are providing more preventive services, like your son has to get a sports physical and it's due tomorrow and he tells you on a Sunday night. That's the thing that they can provide, as well as some elements of chronic illness care, but our data doesn't support that people are going to those clinics for those reasons. Mostly they're going for the immunizations and the simple acute problems.
Susan Servais, what interests you now about this development, the way these new providers are taking shape?
We agree that they serve a purpose. There is a role for these clinics, and our concern is simply that we need to make sure that there is communication between these urgent care centers or clinics and the patient's primary care provider. We want to make sure that it's not just a matter of the patient being given a piece of paper saying, okay, you had a flu shot or you had strep throat and we took care of it, bring this to your doctor, but rather, since we are all really getting electronically literate these days, there's no reason why there can't be a more direct communication with the patient's primary care provider. And I think that once we get that squared away, these are really a great option to make sure that people don't use an emergency room when it really isn't necessary. So I think that it's the communication piece that we still need to work on. It's very important that patients continue to see a primary care physician. That is the person that really gets to know them. That's also the person that when a child or an adult goes into their office, they do a complete physical. They also ask them questions about what's going on in their home life, or what are some of the socioeconomic issues that they've been having to address in their life that might impact their health. A pediatrician asks a child, are you being bullied, or do you feel safe at home? And those kinds of questions now, when we're talking about treating the whole patient, are very important. And so these clinics are great for when you need to get in and get out. They're convenient. They're very attractive for that reason. But when it comes to really taking care of the whole body, we still need to make sure that patients are directed to their primary care physician for an annual physical, for preventive screenings and other things if they're not getting it elsewhere.
Dr. Mehrotra, what about the cost benefit we've been hoping for, that more of these providers will mean less traffic at emergency rooms at hospitals? Is that really happening, you think?
Yeah, so I think the first thing is, what is the price difference? And so the retail clinics, if you look at a spectrum, retail clinics on one end, primary care doctor offices, urgent care centers, and emergency departments. Now, retail clinics are by far the cheapest, but they also have the most limited scope of care. They are about 30 to 40% cheaper than a doctor's office or an urgent care center, and about 60 to 70% cheaper than an emergency, much, much cheaper. So on a per visit basis, they're much, much cheaper. And so therefore, especially as we have a growing number of people in Massachusetts and nationally who have high deductible health plans who need to pay for a lot of that care out of their own pocket, it's a great option for them instead of the emergency department. Having said all that, while we know that our emergency departments have a lot of patients who come into them and they are jam-packed, we do have this, the number of patients who are going there for these types of problems is relatively small in our population. So while it might be decreasing slightly the emergency department visits, I don't think this is a panacea by any means to try to decrease the burden on our emergency departments. And I think most patients who are going to these clinics are probably going there instead of going to their primary care doctor.
Dr. Mehrotra, what about how this fits in with the other kinds of providers? Community health centers, there's a model, there's a strategy around healthcare that plugs in people to prevention and wellness and continuity of care. So are they going to be financially threatened by this?
Right, so I mean, it is an interesting thing. You have the idea of the patient-centered medical home, which is going to provide the comprehensive care, and then these clinics are coming on, which are offering a very narrow, just certain aspects of care. There has been a lot of concern from the primary care community that these clinics are going to come in and cherry pick. That these clinics are coming in and taking visits because the people who tend to go to these clinics have insurance and maybe tend to be more on the higher end of the socioeconomic scale. They are the visits that they're getting the higher revenue, and therefore it could negatively impact financially those clinics. And that there could, especially for pediatric practices, that this could be a threat. The truth of the matter is that there's a limited number of primary care providers in Massachusetts, and there's a lot of demand. So I don't think there's going to be a shortage of people coming into primary care. So there has been concern, but I don't know if there's really evidence that it's really had a negative impact in terms of their finances.
Thank you both very much, Dr. Ateev Mehrotra and Susan Servais.